So if you hear that sound, you know that we're going to be talking about money in the Money Tree series. It's a series that I set up, and actually we're completing with this series, or completing the series with this episode on pharmacies. And, you know, why am I doing all this? Why am I doing the Money Tree series? Why am I creating this podcast? And I think one of the things that has intrigued me is, as far as the business of medicine is concerned, is how much physicians and healthcare providers, nurse practitioners, physician assistants don't really understand the business of medicine. My wife loves Hallmark, and she watches the Hallmark channel, especially during the Christmas season. And you cannot watch a show or a movie without seeing tons of Medicare Advantage commercials. We're in the middle of open enrollment, and patients are signing up, and we need to understand what they're signing up for. And I think one of the things that I've done is created this series, and I'll kind of summarize that when we get back after the intro.
Welcome to the Practice Impossible podcast, where your host, Jude Pierre, MD, also known as Coach JPMD, discusses medical practice topics that will guide you through the maze that is the business of medicine and teach you how to increase profits and help populations live long. Your mission, should you choose to accept, is to listen and be transformed. Now, here's your host, Coach JPMD.
So welcome back. So, today's episode is going to be on the pharmacy and how it affects the payment tree and the costs associated with it. This is a difficult topic, so I'm going to try to summarize things as best as I can. And some of the details of the aspects of the pharmacy payment and how it works in the Medicare Advantage realm is in my course on Medicare Advantage. And you can always sign up at www.learnaboutmedicareadvantage.com and sign up for the free course. And there you'll find some more in-depth details about the pharmacy expenses and how that affects your reimbursement and your revenue. So pharmacy expenses. So how does this all work? Pharmacies are everywhere. You've got a CVS, Walmart, Walgreens, Publix. They all have pharmacies, and they're all competing for the business of your patients. And one of the things that you have to understand is that Medicare Advantage plans receive monies from CMS to purchase drugs or to reimburse patients or pharmacies for drugs that are dispensed by physicians. And so CMS gives a set amount of money per patient, depending on the acuity of that patient or the disease processes that the patient has. And that's and the money is given as part of the Part D payment to the health plans. So CMS gives this Part D amount based on actuarial data from people that are much smarter than I am, who come up with these numbers to reimburse or to distribute monies to health maintenance organizations, HMOs, Medicare Advantage plans, right? And these monies are then distributed based on the contracted rates that the pharmacy benefit managers negotiate with wholesalers, with retail pharmacies, with manufacturers. And it's a whole complicated reimbursement system that's so complicated that I had to find a diagram that actually details all of these things. And I'll share that in the show notes. But one of the resources that I used to understand how this all works is through the Drug Channels Institute. And they came up with a U.S. distribution and reimbursement system that kind of organizes the whole patient-administered outpatient drug product flow, financial flow, and contract flow. And I'll share that in the show notes. I don't want to get into the weeds in this podcast, but I basically want to detail how we as physicians can save monies when we are taking care of our patients in the managed care world. one of the things that you have to understand is that brand names medications are going to cost the health plans more. And of course, if the patient needs these brand name medications, then do prescribe them. I'm looking at a screenshot here of Eliquis on GoodRx, and some of the pharmacies are charging retail price of $635. Discounted costs are $553. So if you have a member that's on Eliquis and they're needing this every month, that expense is going to go towards that patient's benefits that are given to them by the Medicare Advantage plan. So if, let's say, the benefits for that member is, let's say, $5,000 a year, well, within how many months? 10 months? 10 months, then that patient would have used up all of their benefits, and their costs are going to go up unless they reach a catastrophic phase. And that's another thing we can talk about, and we do talk about that in the course. That's called a coverage gap, or the donut hole, they used to call it. And so what if we prescribe a generic medication? Well, if you prescribe generics, let's say you have a patient that can't take Eliquis, doesn't want to take Eliquis, can't afford to take Eliquis because of the copays, then you can prescribe warfarin. We have our warfarin clinic in the office, and the patients really don't have to pay anything to get their labs drawn, and we're able to manage their PT-INRs in the office and with no copays for the checks, and they usually don't have a copay for generic medications, which allows the patient to not have to spend as much money. Now, sometimes you may say, well, Eliquis may be a better drug, Pradaxa may be a better drug, or whatever the anticoagulant is. But if the patient's not taking that drug because they can't afford it, then what's the point, right? So another way to help save the patient money, which will in turn save you money, is to prescribe generic medications like we just talked about, but also to have patients pick up those medications from Walmart. Walmart has a $4 prescription drug plan that includes some generic medications that patients may already be on. And some of those medicines includes gemfibrozil, fenofibrate, atorvastatin, some of the diabetes medicines I'm looking on this website here, glimepiride, glipizide, metformin. All these are $4 drugs that are available. And if the patient pays $4, then that won't go towards their pharmacy benefit from the health plan, which will in turn help you save money. Another way is samples. So let's say a patient has to be on Eliquis and you want to support them because they don't have the ability to come to the office or get their INRs checked. Then what you can do is give them samples of medications, which we sometimes do in the office, which will offset the cost. And if you give patients samples of medications, then that does not go towards the patient's Part D plan and thus saves money. So that's just another way. I was looking at Publix. I didn't know this, but I just, in doing research for this course, Publix used to actually give free medications, free antibiotics, free metformin. I have a family member that lives in Haiti, and she would come and visit us, and she's on metformin. And we used to get metformin for her from a 90-day basis, 90-day prescriptions, but they did away with that program. So as of June 2022, it looks like. So Publix no longer has the free list of medications. But there are some other pharmacies that might have that. So again, it's about doing some research for your patients and allowing them to get generic medications if they can't afford or can't take the brand name medications. So that's another way. So depending on the health plan, different health plans may provide different benefits for the members and for the patients. So sometimes patients may switch medication or switch health plans to get better drug benefits. But with that may decrease other services or other things that they may be getting from that one plan that they're switching to. So this is a time that patients enroll in different health plans, looking for better benefits. And the goal is to understand this process and to kind of understand what patients are going through on a yearly basis. Because if we understand it better, then we can serve our patients better, and we can understand and have empathy for them in terms of the medications that they may be wanting to be on or be off of based on different reasons. So I hope this Money Tree series helps you in understanding what we do in managed care and how monies are distributed. And if you want to see the full diagram, you can go to www.coachjpmd.com/moneytree, and you can get a download of that. And we're winding down this year, and we've got some exciting things coming down the pipe. A great interview for my first video interview podcast is coming. So stay tuned for more, and we hope to see you in 2 weeks.